Welcome to Native Talk Arizona, Native Health's Native American Cultural Affairs program, presented by Native Health and KRDP 90.7 FM. I'm Susan Levy. Phoenix Indian Medical Center, or PIMC as it's fondly called, will be hosting Drug Take-Back Day and their Trunk or Treat, which is so much fun, on Saturday, October 25th. In the studio to tell us more is PIMC's pharmacist, Lieutenant Commander Arrol Perry. Hello, and welcome back to Native Talk Arizona.
Good morning.
Good morning. I can't believe it's been a year since you've been here.
Yes, so much has changed in 1 year. 1 year goes by so fast nowadays.
It does, and the older you get, the faster it goes.
Yes.
So before we get started, tell us a little bit about yourself, your journey, and I also want to find out how you got interested in being a pharmacist.
Yeah, of course. So myself, I'm currently, my duty station is at the Phoenix Indian Medical Center. I've been there for 5 years now. Prior to that, I was a PGY1 resident at Santa Fe Indian Hospital, where I completed my PGY1 in ambulatory care and inpatient setting as well.
That's pharmacist?
Yes, as
Okay.
a pharmacist.
Okay.
So I learned a lot there, had to quite gain a lot of education during that time. And then that's the same time I commissioned to be a commissioned officer with the United States Public Health Service. Prior to that, I completed my pharmacy education locally here in Glendale at the Midwestern University
Oh, wow,
college
I didn't know
program.
that.
Yeah,
Okay.
yeah. So,
How'd you get interested in being a pharmacist?
so I got interested in being a pharmacist with the lack of just connection I noticed with a lot of patients within Indian Health Service, especially my grandparents. They were prescribed medications that they weren't really educated on, and they didn't really know why, rhyme or reason. So I felt like me kind of establishing that connection to kind of show them that, yes, someone being from a local community could bring that connection back together. And I also want to educate myself, too, on why these medications are important, and educating family members and other people in the community to take their medication as directed. So I feel like as a pharmacist, we are the safety net to help patient understand their reason and rhyme for medication.
Totally makes sense, but you're so warm and welcoming and not intimidating. And I would think that's a great thing, because sometimes I know you see pharmacists and they're kind of, I don't know, not very approachable, and you're very approachable. And I bet your grandparents and your family is so proud of you and that you've done this. I mean, right?
Yeah.
I'm sure.
Yeah. I appreciate your kind words.
I mean,
Yeah.
I think it's true. When you stop at a pharmacist, I know they're often so busy and overwhelmed and not always very, I know it's a busy job, and I know it's an important job, and that you have to pay attention, obviously, to what you're doing, because your job is like the most important job, because if you make a mistake. So, and then do you go back home to see your grandparents very often?
I do, yes. I still have that connection with them. I'm thankful for all the valuable life teachings that they have given me and showed me. And I wouldn't be here where I am today without their knowledge and their care and their love.
Oh, did you grow up at Navajo or down in Phoenix?
I grew up, majority of my life I grew up on the Navajo Nation. It wasn't until I left high school to come to Arizona State University.
Oh, a Sun Devil.
Yes.
All right.
Yes, I'm a Sun Devil.
We love those Sun Devils.
Yes. So definitely enjoy the games every now and then that they do have here. So I graduated with 2 Bachelor's of Sciences at Arizona State University, microbiology and American Studies. So after that, I was kind of short on pharmacy requisitions, and then I decided that I do want to pursue the pharmacy route. So I had to take a few extra courses. And then I took the Pharmacy College Admissions Test, or the PCAT they call it. I was able to apply to several local pharmacy school universities here, or pharmacy programs. And I just selected Glendale.
And you like Midwestern?
I did like Midwestern, yes. Yes, it was a 3-year accelerated program. Being an accelerated program does test your educational knowledge and how much you can retain. It is a extensive program as opposed to another 4-year traditional or even 6-year traditional pharmacy colleges that are out there. So yeah, definitely taught me a lot about time management.
So I know that in terms of pharmacy, you have to do like a residency, right? Or like some kind of practicum. I'm not sure what it's called. Is that true, still current, or?
Certain institutions do require residencies just because they want to have that background knowledge education prior to you onboarding to their institution.
Oh, okay.
So not every institution does require residency, but it is preferred, especially when you go into remote locations, such as a lot of sites on the reservation, on rural reservations. It is good to have that knowledge base and educational training prior to your start, but it's not required.
Okay. I knew somebody had recently gone through that, or was my friend's daughter, and she said like she had to, I don't know, work in some pharmacies for a while to get experience. I don't know. I was kind of curious. Okay. All right. So let's bounce back to Phoenix Indian Medical Center's. Their drug take back day and their trunk or treat health fair, which is going to be super exciting. I was there last year and it's a lot of fun. And it's going to be Saturday, October 25th. What is National Drug Take Back Day?
So National Drug Take Back Day happens twice a year at sites all over the country to encourage people to clean out their medicine cabinets, get rid of old, unused, and expired medications. Phoenix Indian Medical Center is proud to be working with the Phoenix Police Department to host a collection site at our community on Saturday, October 25th. In addition, in providing a way to safely get rid of old or unused medications, we will have our annual health fair and trunk or treat event, some food trucks, and Indian market. It was fun last year. We hope to bring an even bigger crowd to enjoy the festivities this year.
It is a lot of fun. Okay, so you said the drugs that you're taking back are things that you're not using. Can you also bring like pet meds? Because like I have a bunch of pet meds that are expired. Is that okay?
Yes, we considered pet medications still medications.
Okay. Why is Drug Take Back Day important?
It gives us a safe and secure location to dispose of medications. By removing medications that are no longer being used from the home, it can help prevent children, acquaintances, and even pets from getting into medications that were not prescribed to them.
And I'm sure it's a lot better than putting it down the toilet or in your garden, right? Okay. All right. How can you tell if someone in your household's using medications that are not prescribed to them?
Great question. If you find yourself running out of medications earlier than expected, it could be a sign that someone else could be using your medications. It is important to store medications appropriately where others, such as pets, children, visitors, cannot get into them, such as a lockbox. It can be dangerous to share medications with someone who is not prescribed the medication, especially controlled substances, which have an additional risk of overdose and abuse potential.
Ooh. All right. So let's go back. So the PIMC's Drug Take Back Day and the Trunk or Treat Health Fair is Saturday, October 25th. What time does it start?
Drug Take Back Day will take place Saturday, October 25th at the Phoenix Indian Medical Center on the northwest corner of 16th Street and Indian School Road in Phoenix from 10 a.m. to 2 p.m.
Okay. It's on the patio again, right?
We will have a drive-through drop-off location on the west side of the main hospital and an information booth at the health fair. The health fair and Indian Market will be on the east side of the hospital near the main entrance.
Okay.
There will be signs and volunteers to direct visitors where to go.
Okay. So can anybody attend this event?
Great question. The event is open to the public. Anyone can stop by, drop off old, unused, expired prescriptions or over-the-counter medications.
Okay. So what can't be dropped off? Does that include things like ointment, liquids?
Yes.
What can and cannot be accepted?
We cannot accept liquids,
Okay.
liquid medications, creams, ointments, inhalers, aerosols, sharps, or needles.
Uh-oh. All right. So I have a bunch of that stuff at home, like those creams and ointments. So how do I get rid of that? So I've got like a bunch of dog ointment and cream and liquids for their ears. What do I do with it?
You can look up other National Drug Take Back Day events on the DEA's website at www.dea.gov/takebackday to find a collection site near you. You also have other helpful resources, including lists of year-round drug disposal locations in your area. Drug Take-Back Day programs are always the safest way to get rid of unused medications if you don't live near a drug disposal location. For many medications, they can be safely disposed at home by mixing unused medications in used cat litter or coffee grounds, sealing them in a sealable container, then discarding of them in the trash. The FDA also has a flush list of certain medications that have a high risk of harming people from accidental exposure, but low risk to the community. Make sure to check out the FDA's website at www.fda.gov to use the search function for all other resources.
Okay, so it sounds like I can mix my dog's ointments with cat litter or coffee grounds.
Yes.
Okay, all right. Okay, so I'll have to do that, and then probably their liquids too. All right. Anything else that you'd like to tell us about Drug Take Back Day? Are you going to be there?
Yes, I will be there. As I mentioned earlier, we will be combining this event with the health fair and Indian market. So bring the entire family for some fall fun. Kids can come in costume and participate in our trunk or treat event, while families can speak to our various department representatives and get valuable health information. For patients who are eligible to receive care at PIMC, our immunization clinic will be open for vaccinations.
Oh, that's cool.
Yeah. Our Indian market will feature many vendors selling a variety of arts, crafts, and gifts, so it is a great time to get your holiday shopping done early and support local artists and businesses. We hope to see you there again.
It's a lot of fun. I know the Halloween part was I was up at the Halloween part, and we were giving out a bunch of really good goodie bags, and I know there was all kinds of stuff going on up there, up on the patio.
Yes.
So it should be a lot of fun. Well, it was so great to have you back. I always love seeing you, learning more, and how you got interested in pharmacy school and how you ended up at Midwestern. And I did not know you were a Sun Devil. So go Sun Devils, and thanks for coming on.
Yeah, I appreciate it. Thank you for having me once again. And I always enjoy having this conversation with you and bringing this information out to our public.
Coming up next on Native Talk Arizona, Brooke Bender and Kiana Becerra will discuss the Community Health Representative Summit on October 27th through the 29th. Support for KRDP 90.7 FM comes in part from Native Health, with 2 locations in Phoenix, 4041 North Central Avenue, Building C near the corner of Central Avenue and Indian School Road, and our NHW Community Health Center, located at 8800 North 22nd Avenue. Native Health is also located in Mesa at 777 West Southern Avenue near the corner of Southern Avenue and Extension Road. Native Health provides primary medical, dental, behavioral health, WIC, and wellness services for the urban Native American community. For more information, call 602-279-5262 or visit our webpage at nativehealthphoenix.org. Native Talk Arizona returns after this song. You are listening to OFY by Smokey D. Palmtree.
Welcome back to Native Talk Arizona, Native Health's Native American Cultural Affairs program, presented by Native Health and KRDP 90.7 FM. I'm Susan Levy. Now, the Community Health Representative, or CHR Summit, brings together community health representatives, also known as community health workers, tribal health leaders, public health professionals, and key stakeholders to strengthen the role of community health representatives in advancing health equity, improving community-based care, and addressing social determinants of health in Indigenous and underserved communities. On the phone to tell us more is Brooke Bender and Kiana Becerra. Hello and welcome to Native Talk Arizona, Brooke and Kiani.
Hi.
Hello.
Well, welcome. I can't wait to learn more. So let's start at the beginning. Brooke, can you tell us a little bit, what is a community health representative?
A community health representative is a workforce that serves tribal communities. They are the frontline public health professionals that serve as liaisons to healthcare services or systems such as Indian Health Services. They do a lot of case management. They serve marginalized populations in rural areas. Sometimes the CHR is the only connection that they have to a health care worker. So providing that advocacy, the essential checkups, ensuring that they have nutrition in their homes, and they're connecting them to multiple resources and addressing chronic disease issues within their health. And they sometimes are certified within the state that they work in.
Okay, so you mentioned they help with food or nutrition and other things. So what do they do? Do they go out to somebody's home and take their blood pressure or blood sugar? Do they look at everything in the home and say hey, that might be a fall or trip hazard, or you need food, or you need utility assistance? You mentioned case management. What do they actually do in the home? I assume it's in the home, correct?
It's majority in the home, yeah. So what normally happens is that they get a referral either from a community member or a self-referral, or they get a referral from the public health nursing or a clinical provider. And what they do is they go into the home, they do a workup assessment, so they'll review their chart, ask them questions about their history, and then they kind of base their services on that information that they obtain from the patient. And sometimes what happens is that when they're in the home, they get to see a glimpse into the patient's actual living conditions. And the way I kind of see it is that when you go to the clinic, you only get a glimpse, within that 15 minutes, of what the patient's issues are, but you don't actually see the behind-the-scenes stuff. So the living conditions, the home, are they actually taking the medication? So CHR gets a full glimpse of what the home environment is and addressing those. So they can report back to the provider if referral came from them, and they give them a better idea of what is probably the issue. If there is food insecurity, they can address that by coordinating a food box, or getting them connected with the Meals on Wheels program, or get them applied for congregate meals. If they don't have any health care, then they can help them get an application submitted for some either a Medicaid, or utilizing their Medicare, getting them connected with the transportation. So a lot of the work is it's a lot of heavy lifting on the back end for CHR, and they're just trying to connect people to the resources, but being an advocate for them.
Okay, so if they were going in a home, they could do their blood pressure, right? They could check that?
Yeah.
So they're all certified or trained in doing blood pressures, blood sugars, and just general things like that. And okay, so then they would do that, and then they'd be able to look around and say, hey, you know what? They need food, or they need maybe a walker or a wheelchair or assistive devices. And then are these CHRs, or community health representatives, are they employed by the tribe, or are they employed by another organization?
No, the majority of them are employed by the tribe. So they're a service that's contracted through Indian Health Service, and usually tribes are the ones that are contracting those services, and they utilize those funding that they get from IHS to train and employ and provide these services to the communities that they serve.
Wow, what an amazing opportunity. One, I think one is a career, right? I assume that this is open to work with tribes and get hired and get trained, but also for the community. It's somebody that you know, somebody that you trust, and everything else, right?
Yes.
And they know the resources of the community because they live there.
Yes. Like, they are the ones that know every resource. And the funny joke that we always make with CHRs is, like, if you need to know about the latest gossip or where somebody is at and you can't find them, ask a CHR, because the CHR will know where exactly that person is.
Wow, what an opportunity. All right. So they're community health representatives. The tribes hire them. I know your people are always looking for positions, and tribes are always looking to hire. And then we're going to talk about the Community Health Representative Summit. So what is, and I know we're going to jump to Kiani. So what is this summit for? What is, tell me all about it.
Yeah, absolutely. So to give some historical context, the first summit was held in 2015, and that was in response to some major policy shifts that were happening at the state level that directly affected community health representatives in their daily work. And so this first summit was largely coordinated by the agency that I represent, along with a lot of other partners. And so I am currently with the Arizona Advisory Council on Indian Healthcare, and our director at the time, Kim Russell, coordinated with some of the organizations that we see still involved today, like ASCHOW and all the tribal CHR program managers. And so the pillars of this event and how it began still ring true today. We really focus on sustainability, impacts of policy that is on the horizon, and assessing the workforce to see if there are any areas that really need additional assistance. So that's kind of our primary objectives there. And this year we're following through with that with our theme, which is rooted in resilience.
So the summit's coming up, I believe, in a couple weeks, right? Or at the end of October?
Yes. So this year it'll be October 27th through the 28th.
Okay. Now, who should be attending this summit? Is this for people that are already community health representatives, or is it open to agencies or tribes? Tell me a little bit more about the schedule and what's going to happen and who it's for.
Yeah, absolutely. So this is open to any community health representative in the state of Arizona and beyond. So though we do specifically coordinate with our Arizona tribal programs to cater our agenda for them and their wants and desires, we do offer trainings and resources that can be applicable to anyone outside of Arizona as well. And then we also welcome any allies from different public sectors, so other tribal healthcare organizations, Indian Health Services, state, local level, and university partners as well are more than welcome to join and share resources, and it'll be a valuable event for them to attend as well.
Okay, and you said, where's it going to be held? I might have missed that.
No, you're fine. It is going to be held this year, October 27th through the 28th at Wecopa Resort and Casino, which is in Fort McDowell, Arizona.
Okay, so centrally located in Maricopa County, or right outside Maricopa County. Mm-hmm. So, Brooke, what kind of training is going to happen at the conference or opportunities?
We are having a pre-conference workshop happening on the 27th of October, and it's being sponsored by Northern Arizona Center for Health Engaged Research, and it's going to be focusing on community health representatives and community health worker programs to navigate Medicaid billing, also talking about reimbursement, and then like the steps to apply to be a provider with Medicaid, and then leadership engagement. So that's like one of the big things that we do have going on with the conference. And then we also have like a keynote speaker. Her name is Joyce Hamilton, and she is the director for the Hopi Tribe Health Department. She's a former CHR program manager, and she is now a longtime ally of the workforce and continues to be promoting the workforce, the CHR workforce within tribal communities. So there's other trainings happening too. So we have partners like the CAN Health, which is going to provide HIV and STI education. We have diabetes education, mental health, discussions on chronic disease. And one of the proud ones that I'm very happy about this year is that we are doing re-upping. I guess it's more what we call on our trainings, like we talked earlier about, like blood pressure, blood sugar checks, so we are going to have staff and nursing staff available on hand to go through the hands-on with each CHR to recertify them in their skills on that. So I'm very happy that we're doing that this year.
That sounds like great. So they're going to get their competencies done and knock out everything during the summit. So, Kiani, again, when and where is the CHR Community Health Representative Summit going to, when and where will it be held?
So this year we are fortunate to have the Fort McDowell Yavapai Nation hosting us at the Wekopa Resort and Casino in Fort McDowell, and that'll be October 27th through the 28th. And there is still plenty of time to register.
Awesome. All right. And if somebody has any questions, would they email you, Kiani, or email you, Brooke, or where should they go for more information?
Yeah, so we can go. We can have you go on our registration website for more information, and that website is chrsummit.v like Victor, S like Frank, A like Apple, I like Igloo, R like Richard, S like Sam.com.
Awesome. All right, and you said there's still room for people to register, right?
There is, yes.
Okay.
And we have a ton of other information on there, like our preliminary agenda of what's going to be happening. We acknowledge some of our sponsors, and we also have award nominations that are available to be submitted through the rest of this week.
Okay. All right. Well, we highly recommend people check it out, register, attend if you're a CHR or I don't know, learn more about it. And I just wanted to say thank you so much, Brooke, and thank you so much, Kiani, for coming on and telling us about the upcoming summit.
Thank you.
Thank you so much.
Up next, Susan Levy chats with Native Health pharmacist Eric Scherf about the new pharmacy at NHW Community Health Center. Support for KRDP 90.7 FM comes in part from Native Health, with 2 locations in Phoenix, 4041 North Central Avenue, Building C near the corner of Central Avenue and Indian School Road, and NHW Community Health Center located at 8800 North 22nd Avenue. Native Health is also located in Mesa at 777 West Southern Avenue near the corner of Southern Avenue and Extension Road. Native Health's patient enrollment specialist can help you enroll, renew, or update your access information. This can be done in person, on the phone, or via Zoom. It's fast, easy, and can make a difference in keeping your health care coverage. For more information, call 602-285-9492. Native Talk Arizona returns after this song. You are listening to Mighty by Jace Martin.
Welcome back to Native Talk Arizona, Native Health's Native American Cultural Affairs program, presented by Native Health and KRDP 90.7 FM. I'm Susan Levy, and in the studio with us today is Dr. Scherf, and he is Native Health's new pharmacist, and I'm super excited. Welcome to Native Talk Arizona.
Thank you.
All right, so tell me a little bit. I've met you a few times, and you are so warm and inviting and kind and genuine. How did you end up at Native Health?
Sure, it's a bit of a journey. I'm certainly glad this is where it's taken me, but it took a bit to get here. So originally, I am from Indiana. I come from this far-off place called Indiana.
All these people are from the Midwest and ending up at Native Health. All right.
So born and raised Indiana, I am the prototypical farm boy, and I went to Purdue University, which is where a lot of the farm kids go. Yep. They just happened to have a pharmacy program there. So I was enrolled and accepted, and graduated with my PharmD as well. My wife was about a year behind me in school. And when
she's a pharmacist?
She's a pharmacist as well, yeah. So we decided we wanted to get out and see the world. And we felt like cornfields was not the world. So we actually went from Indiana after graduation to Tucson, Arizona.
Okay.
And so, I've worked for Walgreens for quite some time at that point, and they had us all over the U.S. in a variety of different leadership capacities, not only within the pharmacy, but also on the front end of their operations as well. So been a little bit of everywhere, learned a ton from Walgreens, and there's some good in that. And then after that, made the transition did some mail order and even some specialty pharmacy as well for about 3 years, respectively. And again, learned a lot, and there's actually some applicable lessons learned from that I'll be able to use here at Native Health as well.
So you've been in Phoenix, so you moved from Tucson then to Phoenix?
So I went from Tucson to Seattle, Washington.
Okay.
Completely different climate, different way of, a lot of things are different.
Beautiful up there.
Yeah, it's very beautiful. Great time of the year to go there is in the summer to visit. But a good place to be. It was a very interesting assignment at that point because I had the downtown marketplace, the Pikes Market.
Yeah, Pikes Place Market, yeah.
Yeah, so that was my territory. So saw some of the urban challenges that are present sometimes in some of those locations. And then I'd hop on a plane and go to either Fairbanks or Wasilla or somewhere in Alaska, sometimes even the same day.
From Walgreens?
From Walgreens, yeah.
Oh, my gosh. Okay.
Yeah.
I've been to Wasilla, and I've been to Fairbanks. All right.
Mm-hmm.
Sweater weather, right?
It can be at certain times of the year, yeah, sure. It's no joke. They do have long days, and then other times of the year long nights. But it's no joke. It really does work like that.
Yeah, we were there a couple years ago. It was like the sun was setting at 3 a.m., 2 or 3 a.m., and then coming right back up at like 5.
Yeah,
it is a little disconcerting.
It is. It's
like
different.
3 a.m. and time. You should go to bed at 10 or 11 or 12 or whatever, and yeah.
It takes a little bit for a lot of folks to get used to, for sure.
And I would imagine the winters are pretty tough.
They are, particularly the further north as you go. So when you get up to Fairbanks, I can remember the first time I ever went there, I got off a plane, it was like 30 below. They had all these unique sort of devices that people were plugging their cars into when they went grocery shopping. I was like, what is that about? They're basically engine block heaters so that your car doesn't freeze up while you're inside shopping for 30 minutes.
We have the opposite problems here, right?
Yeah.
115 for months on end or weeks on end. And all right. Okay, so you ended up at Native Health, and you're going to be opening up a new pharmacy, I understand, right?
Yeah, super excited about that because that's going to be a journey in and of itself. So this is the first step in that journey, opening up our very first entity-owned pharmacy. But I think there are going to be a lot of things coming after that over the coming years.
All right, so let's talk about the pharmacies going at our NHW Community Health Center site, which is West or Dunlap, whatever you want to call it.
Yep.
Which is near 22nd Avenue in Dunlap, a little bit south of there in our beautiful new building. The pharmacy is gorgeous. I know you have a new sign up. It's up on the monument sign.
Yep.
And so you're planning on opening you said in the end of October?
Yeah, sort of the end of October, that last week. Our goal is to fill our first prescription then. As you had mentioned, the pharmacy is actually going to be inside that Native Health West Community Health Center. So we'll be located in there. It's not a side, unit or anything like that. It's inside.
So you'll come in the front doors.
You come in the front doors,
and sit in the lobby, and then you just walk up to the pharmacy window.
Yeah, as soon as you walk in, you're probably going to see us off to your left.
Okay. Is this open to anybody, or do you have to be a patient?
Great question. So this is going to be a full-service community center, community pharmacy, rather. And when I say community, I mean that. So it's not just for our own patients that go to Native Health for a variety of different primary care needs or perhaps even dental or behavioral health. But anybody, frankly, can walk off the street. If they've got a prescription from a different provider, we can fill it there as well. And that includes our own employees also. Okay.
So it also, you can, you could have been a patient or a client of like any other pharmacy chain in town and go to this clinic and get your prescription filled.
Yep.
All right. So you're going to accept all insurance plans and access plans.
Yeah. So I'm going to say virtually all, because I'm afraid there might be one nuance, one-off out there. But for the vast majority of cases, yeah, it'll be so the typical, Arizona Medicaid access plans. We should be enrolled in all of those. That'll also include, a lot of the major commercial carriers that are around here, but even some of the smaller employer groups, private insurances also.
Okay.
Medicare
Blue Cross,
Part D,
Blue Shield, all the big ones, United.
All the big ones, and probably a few of the smaller ones that most people have not heard of.
Okay, and what about, I'm going to throw you for a loop here, what about American Indian Health Program under Access?
So as long as it's under the Access program, that should be one of the programs that we participate in as well.
Okay, cool. All right, and then I don't know if you know the answer to this. Are you going to have a discount program for prescriptions?
Yeah, so we're going to go about this a couple of different ways. We are going to be a participant in the Native Health discount program, sometimes called sliding fee scale.
Okay.
So we are going to be an active participant in that. The way that works generally in most federally qualified health centers is that there's a group of folks that evaluate patients for eligibility. They'll look at what's your household income, what's your household size. They'll use a few different pieces of demographic information and tell you, A, do you qualify? And then B, if you do, which tier they might assign you to. So we're going to be playing a role in that. We'll have...
So it's our patient enrollment specialist, right?
Yes.
So depending on if you fall under... So they'll determine whether you fall under like level 1, 2, or 3, right?
Yes.
And then you'll have a tier. So if something costs X amount on level 1, a little higher on level 2 or lower, so then they're the ones that will tell you. And you don't have to be a patient for this, right? Or do you?
So under federal law, the sliding fee scale program, you do need to be a patient for that one.
Okay, all right.
Yeah.
Okay, so in order to use a sliding fee scale or a discounted program, you do have to be a patient. But other than that, you can just be a community member, walk in. If you're on Access or private insurance, and if you're on private insurance or copay, and you just walk in and say, hey, I need my amoxicillin or, I don't know, my Benadryl cream or something.
Sure. Yeah, you can come to our pharmacy and you'll get charged the same copay as if you went to a Walgreens or a CVS or Fry's. It'll work the same way. Now, if you don't have insurance, you don't qualify for sliding fee scale, we'll have discount cards available as well. So we'll participate in those. Not every pharmacy necessarily does that, but we will.
And those are the GoodRx?
Similar to GoodRx, yep.
Okay.
That's one of many that's out there in the marketplace right now.
Okay. And then are you going to have like over-the-counter supplies and medication or just prescriptions?
Great question. So we will have over-the-counter products and merchandise. However, we will have to deal with some space constraints. So, for instance, if you're like my son who wants the newest gift card for his PS5 or something like that, we won't have gift cards. We won't have cosmetics. We won't be in a position where we can carry a lot of like the snacks and things like that, but we will carry, a few core over-the-counter elements like, fever reducers or pain relievers, allergy, maybe a few cough and cold, that type of thing. So we'll have a few items.
Benadryl cream if you needed that or something like that, you would have that. And like you said, the allergy medications, which I know most people use out here.
Oh, yeah. And I'm one of those, for sure. Yeah.
Especially as we get into the fall and prime time at the clinic over there.
Yep.
All right, so how's this going to work? So if you're not, let's start, if you're a patient of Native Health, they can just send you the script. Like if you're at, let's say, Native Health Central and you're seeing a provider, they could just send it to electronically, and then they could drive over there because it's only about a 10-minute drive and go get it? Is that how this works? Or?
Yeah, so the first pharmacy is going to be at the Native Health West Community Health Center. That's where it will be the hub of activity to start. And I should underline the word start because this will evolve and change over time. I think over the long term, our goal is to implement a pharmacy service line solution for all clinics and all of our patients.
So exciting.
But that's where it begins, right? You got to start somewhere.
Yep.
So we'll start there. I would say most prescriptions are generally transmitted electronically.
Okay.
We can take fax prescriptions. We can take phone calls from doctors or other providers. We can even take the old school hard copy prescriptions, which aren't super common these days, but utilized sometimes. But the vast majority of it's transmitted electronically, and that's for good reason, to be honest with you. It's a little bit safer. It's a little bit more... there's less chance for errors. There's a lot of advantages to going that route. But regardless, whoever sends us a prescription, whether it's internally from a NOAA provider, they'll send it electronically the same way that somebody from the outside would.
So tell me, okay, so if you're a new patient, let's see, I saw somebody at Native Health, a provider, they sent over my prescription electronically and I come in or I call you. So would I need to register because I have allergies? Would I have to tell you that or would I just walk in?
You could do either. However, you can save yourself a little bit of time perhaps by registering with the pharmacy. We're going to use a different processing system rather than a typical EMR that your doctor might be using.
Electronic medical record?
Yes.
Okay.
Our system's going to be a little bit different. They're not connected. Okay. Some of the information will be sent over in the prescription anyways, but not necessarily all elements. So usually when someone's new to a pharmacy, what they'll do is provide their baseline information like what's your address, what's your phone number, right? But they'll also include things like, allergies and health conditions. We're probably going to need your prescription insurance the first time. All in all, usually obtaining and entering that information into our system usually only takes a couple of minutes. And then after you do that, you don't really need to do it again unless there's some updates along the way. You've got a new insurance card. Maybe you discovered you have an allergy to a medication you didn't know about before. Outside of those one-offs, it's just a one-time registration type situation. At that point, usually we can have prescriptions filled in about 10 minutes.
So that's awesome, unlike some competitors.
Unlike a lot of competitors.
Who will remain nameless.
Yeah.
I know you can be waiting a couple hours or
days sometimes. Yes.
Days. All right. So if you're not a patient, let's just say you live in that area because it's 22nd Avenue and Dunlap. Mm-hmm. I know there's not a lot of pharmacies left in that area. They've closed a lot of them. So could you just walk in and with a paper script or whatever it is, and then just say, hey, I need, I don't know, an allergy prescription or something.
Yeah, you could walk in with that paper script or have your doctor send it over electronically or fax. But what if, for example, you're an established patient in another pharmacy? How do I get my scripts from over there over to the Native Health pharmacy? Really, all you've got to do is just let me know. And let me know where the prescriptions are at, which ones you want transferred. And it's a direct process between the two pharmacies. So I'll get a hold of the other pharmacy, and we'll bring over all your scripts, the ones that you want, and we'll start filling them for you there.
That's pretty awesome. All right, so the plan is when you open it the last week of October, Monday through Friday, 8 to 5, correct?
That's how we're going to start,
okay.
Yes.
Okay. And I know you're going to be closed for lunch, I think in the afternoon, right?
Yeah, from about 12 to 12:30, around the same time the clinic takes their lunch break as well.
Okay. I know I start to see that more and more at more pharmacies than I had seen like pre-COVID. It used to be they would work, I don't know, like 12 hours a day. And after COVID, it's like now there's a lunch break and they close earlier.
Yeah, it's pretty common these days, especially in Arizona.
So I was at NHW this past week, and I was by the pharmacy and looking at all the signs and everything else. And I noticed that you've got naloxone on the wall next to that. And is that available? Is it free? What is that?
Okay, so naloxone is a medication that's used to treat a variety of different issues associated with opioid use, but particularly advantageous for those that might be, for example, have an overdose type situation, or at least at risk for that. So it can be administered right on the spot. What we carry in the clinics is a nasal administration. So we've got it for free. Anybody can come in from the public. It doesn't necessarily have to be a Native Health patient, and they can get it. Now, in the pharmacy, we'll also have medications that are similar to naloxone as well. So that'll be filled via prescriptions. But in any one of our clinics, you can go to the waiting area and pick up your own naloxone at no charge as well.
That's a pretty good thing, because I know, like at our central location, I remember that somebody, I don't know, a couple of months ago ran in from the bus stop and said that somebody was overdosing and they needed it right away.
Yeah.
And they were able to grab a box of it and go out and help the person.
Yeah, and the beauty of it is, for that particular medication, is there are going to be times where someone might have a different issue going on that looks similar to overdose of an opioid. But the beauty of this one is if this is administered and they weren't, dealing with an opioid overdose, it's okay. There's no harm, no foul. You can't say that about a lot of medications. You can with this one.
That's pretty cool. Okay, so after you open up at NHW, which I'm so excited, 22nd Avenue and Dunlap, where's the next location going to be for the pharmacy?
All right, so we got a lot of plans coming up here. So
I like that.
Yeah. Which one is first is the real question. So again, we want to make sure that we've got a pharmacy service line solution for all the clinics. Mesa, let's start there. So Mesa actually has it will also be a full service pharmacy. The space is already built out. They just installed the millwork over the weekend. Looks beautiful. Really, the only thing that I would say that's going to be different about that location is that we'll probably start a model of what's known as a remote pharmacy, not necessarily visible to the patient, but behind the scenes, we'll have a pharmacy technician on site, and then the pharmacist will do their work remotely, perhaps from the West Pharmacy, for example. So they'll do their counseling, check prescriptions, validate the information's all correct, and that sort of stuff, communicate with providers. Again, they'll do all that from the West, even though, they're helping out at the Mesa site. But the experience is probably going to not be a whole lot different than if they came to the West Pharmacy.
But I mean, what you're saying, like 10 minutes to get a prescription is pretty amazing.
Yeah, so that shouldn't be any different. That'll be the same.
Okay, and then after Mesa?
So then after Mesa, we've got to figure out a solution for Central, right?
Well, that's, yeah.
So
not as much space here.
And that's one of the big issues, space, and like what do the time frames look like, at a location like this. Initially, we're looking at a few different options, probably some form of a courier service where we fill prescriptions at the West Clinic, have them brought over to Central. I think a component of that's really gaining some momentum really quickly here is like a dispensing kiosk. So we bring over the prescriptions, we put them in a kiosk. The patient can then pick up at their own convenience when they're ready to. Pick up the prescription. Again, they'll be able to get counseled by the pharmacist, all that stuff remotely. So it'll be the full service experience in many respects, even though they're picking it up from a kiosk.
I think it's going to be fabulous. All right. So we're pretty much out of time. How can the listeners contact you, or how can they find out more information?
Yeah, so I think probably one of the first locations that I would take a look at is our website. We're going to have a link on there that's going to be posted shortly for pharmacy information. So all the hours of operation, insurance information, all that kind of good stuff's going to be on there. Beyond that, though, you can call the pharmacy number. So the number that they can call and actually speak to me is 602-848-3368. And if they want to shoot me an email, if that's how they prefer to communicate, it's NHW Pharmaci at NACHCI.com.
Yep. And then the website should be up soon with the pharmacy page. Mm-hmm. By the time this airs, we'll have the web page up. And then it's just like a matter of days before you open. And I can't wait to see it. And I'm sure you're planning some kind of grand opening. I know you'll also be at the open house.
Yeah.
Also,
I will be there at the open house. It's going to be a great opportunity to reach out to the community and meet some folks and talk a little bit about the pharmacy that we have coming up. But beyond that, so the hope is I'd like to do an open house for our providers and maybe some of our patients for the pharmacy once it's up and running.
It's going to be great.
Yeah, a lot of activity, a lot of things going on for sure.
Well, thanks for coming on.
Thanks for having me.
Thank you for listening to Native Talk Arizona, presented by Native Health and 90.7 FM KRDP. Our executive producer is Susan Levy. Sound engineer is Javier Quiroga. We hope you will tune in again next week. If you have any questions, please reach us at nativetalkaz@listentoKRDP.com.